It is also true that some Americans who have health insurance plans that they bought on their own through the old individual market are getting notices from their insurance companies suggesting that somehow, because of the Affordable Care Act, they may be losing their existing health insurance plans. This has been the latest flurry in the news. Because there's been a lot of confusion and misinformation about this, I want to explain just what's going on. One of the things health reform was designed to do was to help not only the uninsured, but also the underinsured. And there are a number of Americans, fewer than 5% of Americans, who've got cut-rate plans that don't offer real financial protection in the event of a serious illness or an accident. Remember, before the Affordable Care Act, these bad apple insurers had free rein every single year to limit the care that you received or use minor pre-existing conditions to jack up your premiums or bill you into bankruptcy. So a lot of people thought they were buying coverage, and it turned out not to be so good. Before the Affordable Care Act, the worst of these plans routinely dropped thousands of Americans every single year. And on average, premiums for folks who stayed in their plans for more than a year shot up about 15% a year. This wasn't just bad for those folks who had these policies. It was bad for all of us. Because, again, when tragedy strikes and folks can't pay their medical bills, everybody else picks up the tab. Now, if you had one of these substandard plans before the Affordable Care Act became law, and you really liked that plan, you were able to keep it. That's what I said when I was running for office. That was part of the promise we made. But ever since the law was passed, if insurers decided to downgrade or cancel these substandard plans, what we said under the law is you've got to replace them with quality comprehensive coverage. Because that, too, was a central premise of the Affordable Care Act from the very beginning. And today that promise means that every plan in the marketplace covers a core set of minimum benefits like maternity care and preventive care and mental health care and prescription drug benefits and hospitalization. And they can't use allergies or pregnancy or a sports injury or the fact that you're a woman to charge you more. They can't do that anymore. They can't do that anymore. If you couldn't afford coverage because your child had asthma, well, he's now covered. If you're one of the 45 million Americans with a mental illness, you're now covered. If you're a young couple expecting a baby, you're covered. You're safer. The system is more secure for you, and it's more secure for everybody. So if you're getting one of these letters, just shop around in the new marketplace. That's what it's for. Because of the tax credits we're offering and the competition, because of the tax credits that we're offering and the competition between insurers, most people are going to be able to get better comprehensive health care plans for the same price or even cheaper than projected. You're going to get a better deal. Now, there's a fraction of Americans with higher incomes who will pay more on the front end for better insurance with better benefits and protections like the Patient's Bill of Rights. And that'll actually save them from financial ruin if they get sick. But nobody's losing their right to health care coverage. And no insurance company will ever be able to deny you coverage or drop you as a customer altogether. Those days are over. And that's the truth. That is the truth. So for people without health insurance, they're finally going to be able to get it. For the vast majority of people who have health insurance that works, you can keep it. For the fewer than 5% of Americans who buy insurance on your own, you will be getting a better deal. So anyone peddling the notion that insurers are canceling people's plan without mentioning that almost all the insurers are encouraging people to join better plans with the same carrier and stronger benefits and stronger protections, while others will be able to get better plans with new carriers through the marketplace. And then many will get new help to pay for these better plans and make them actually cheaper. If you leave that stuff out, you're being grossly misleading, to say the least.